So a study that was done by UCLA says or found that about 40% of older adults are dehydrated. And dehydration is responsible for about 65% of hospitalizations of seniors. I know for myself, I have a patient who is elderly and spent a couple of days in the hospital recently because she was so dehydrated. So what are the risks of dehydration? In other words, what happens to seniors that makes them at more of an increased risk for dehydration? Well, part of it is medications that they take. Some medications can dehydrate you, some can make you sweat, others can give you diarrhea, and all of those things will lead to an increase in dehydration. Also, their body just doesn't regulate things the way that it used to. Their body sensors, if you will, a lot of times they don't tell them that they're dehydrated, or they feel colder or hotter than what they really would if they were a younger person. So all of these things can add up to the risk of dehydration. So the problem with dehydration in an older adult is that it makes them more susceptible to fainting, which obviously increases their fall risk. And even aside from fainting, they have a higher fall risk if they're dehydrated. They have more chances of having a urinary tract infection or a UTI. They can have more problems of forming kidney stones, more risk of forming kidney stones, a higher chance of kidney failure. They have a higher chance of heat stroke. They have a higher chance of seizures. The symptoms of dehydration, you've probably felt them yourself at some point, but seniors feel them more. They could have a dry mouth. They may feel dizzy. They might have a headache. They might have fatigue or feel sleepy. They might have muscle cramps. They might complain about feeling weaker or just feeling not good. I know I am a runner, and in some of the races that I have run before, especially when we're in high humidity and high heat, more in the summertime, sometimes you just get to a point where you feel like you can't put one foot in front of the other, and that is a classic symptom of dehydration. So the symptoms I just told you about were basically mild dehydration. If you have a senior who has serious dehydration, their side effects or their symptoms are going to be even more compounded. So they're going to have dry eyes, very sunken looking eyes. They're going to have trouble walking. You may find that their pulse is very fast, but also very weak at the same time. You also may find out that they have really bad muscle cramps, like cramps in their legs. I can remember my father, he didn't drink very often because, again, he wasn't thirsty. He used to get cramps in his legs, and his legs would shake. So finally I got him to add more water into his diet, and I'm going to tell you how to do that in just a minute. There's one way that you can tell physically with dehydration in a senior, in anyone I suppose, but in a senior in particular, and that's the pinch test. So what you do is you pinch the skin. See, now mine goes right back down. But if I was dehydrated, you would pinch that skin, let it go, and you'd have that little pinched area that would settle, but very slowly. Or if they're really dehydrated, it may not settle down at all. So that is a big sign. So again, that pinch test is actually a sign more of severe dehydration. And then also you want to look for low blood pressure or fast breathing, like hyperventilating. So the benefits of making sure that you are properly hydrated are that you have less of a risk of bladder cancer. A senior also has less of a fall risk. They have less risk of constipation, and along the same lines, that gives them a reduced risk of colorectal cancer. And as I mentioned at the beginning, they have less of a chance of having a urinary tract infection or a UTI. So obviously, definitely want to make sure that you stay hydrated and the senior that you love stays hydrated. So how much water should you or a senior be drinking? The formula is to take the person's body weight, to take a third of it, and then that amount is what you should be drinking in ounces. every day. So in other words, if somebody weighs 120 pounds, a third of that is 40. Therefore, they should be drinking 40 ounces of water in a day, or fluids. Now, you have to be careful. Some fluids will dehydrate you, like teas and coffees, but they are still fluids. It's something that somebody is, it will help their body, so it is okay. You don't want to be excessive, like they shouldn't be wandering around drinking Monster energy drinks, because that is going to be dehydrating because there's a lot of caffeine. But one of the ways that I got my dad to drink a little bit more was to make him understand that he needed to drink a full glass of iced tea at lunch. So he liked it. They served it in those big drink glasses, that are probably 12 or 15 ounces, something like that. And he committed to making sure he drank that during his lunch. So that was awesome. Another thing that you can do is you can get a bottle like this that has markings on it. So you can mark it off and have the senior make sure that they fill it up every morning to this line, for example, and then make sure that that's all gone by the end of the day. They also have bottles that are marked, they have increments that are marked like morning, lunchtime, afternoon, dinner. So they can fill the entire bottle up, and just be sure that they drink between morning and lunch this amount, and between lunch and dinner this amount, etc. And that way they'll get enough fluids as well. Other ways to get fluids, especially now, it's summertime again, you have watermelon. Has a lot of water in it. So they can eat things, fruits like that are healthy for them, as well as hydrating. Other things that are good would be a soup. Maybe they have a soup for lunch with a sandwich or half a sandwich. The thing about soup, you have to be careful though that it isn't one that contains a lot of salt, because then that's just going to dehydrate them again. Could also do things like smoothies that you're adding a little bit of water to. Fruits that have a lot of water are like pineapple has that. I mentioned watermelon, oranges, and grapefruit. You do have to be careful about having grapefruit with certain medications at the same time, because grapefruit can make medication ineffective or less effective. So just be sure that they're separated. And again, having that coffee, tea, that kind of thing. It's okay if your parent is having a cup or two of coffee in the morning at breakfast. That still counts towards their fluid intake for the day. So one other thing that I want to mention is, if your parent is on a lot of medications, as many older adults are, it's a good idea to check with their doctor to find out exactly how much intake of fluid they want them to have in a day. Sometimes the medication can affect it, and so rather than that 40 ounce, 1/3 of the body weight kind of thing that we were talking about, maybe they need to drink a little bit more, or maybe they need to drink a little bit less. Diuretics, I'm thinking about that can really affect a senior's fluid levels in their body. So definitely check with the physician just to be sure that they're getting the correct amounts. And last but not least, it goes without saying that a senior who is outside in the heat needs to drink much, much more. So if you have a loved one who wants to go out and work in the garden, first of all, in the summer, they should be doing that in the morning when it's cool, probably before 10 o'clock or so if they can, or after dinner type of a thing when it is a little bit cooler outside, but they should not do it in the heat of the day. But when they go out and work in the garden, they should bring a jug of water with them that they are drinking from. So just to be sure that they're, not losing so much of their bodily fluid through sweating. So anyway, I hope that this is helpful for you and that you can get your senior to take in a little bit more fluid. It's definitely better for them if they can. So thank you very much for watching. We appreciate all of our subscribers and our watchers. If you haven't subscribed yet, please make sure that you hit that subscription button down in the corner. There's also a notification little bell that'll pop up, and you can hit that as well. And that way you will not miss any of our informative videos. So thank you very much again for watching. And until the next video, take care. Bye.